Hello, Dr. Ben Galyardt here, and I would like to get in depth into how we're able to change people's lives that are dealing with autoimmune conditions. Autoimmunity is a vast category of conditions. Over 190 named autoimmune conditions in the medical literature. Many of them we've never even heard of. They're very minuscule. But when you combine them all together, they're the third leading cause of death in the United States. Pretty amazing if you think about it when you've got cancer, when you've got heart disease, and all these other things. Autoimmune conditions, third leading cause of death. Some of them are going to be more benign and just annoying. Other ones are going to be very dramatic that are going to affect our health on a lot of different levels. But the big thing to remember with autoimmunity is the vast majority of people that have one autoimmune condition have multiple, so they're dealing with other conditions they may not even know of yet. So what do we do here at the Functional Medicine Center of Fort Collins to really downregulate this inflammatory immune cascade? Because that's really what we can do. There's nothing on the natural side that's going to suppress the immune system like a prednisone or like a chemotherapy or any of these different drugs out there. So what can we actually do to support the body to function better? And that's really what I want to go over today. We need to be able to get in depth into each one of the different systems that are out of balance that are driving this immune inflammatory cascade. So when we start looking at autoimmune, it doesn't matter what somebody has, whether that's Hashimoto's, MS, multiple sclerosis, rheumatoid arthritis, any lupus, any of these different autoimmune conditions. It doesn't matter because we have to get through all these different systems. I put a couple of them up here today that we go over, and in my seminar we get very in depth into these different conditions, and as we start working together we're going to go through system by system by system and rebuild all of these different areas. So one of the first ones we look at is blood sugar. Every time that blood sugar goes up too high or too low, it's going to be stimulating that immune inflammatory cascade. Vitamin D is a huge immune system modulator. It's going to keep that immune system from getting revved up too high or not attacking when it's supposed to. Any infections, Lyme disease, any Epstein-Barr, mono, any of these chronic infections in the body are going to lead to this continued attack that those infections could settle into different tissues and stimulate this immune response. Any environmental concerns, we have a lot of patients that are dealing with mold and mycotoxins and a lot of things going on in the environment that we have to deal with. The gut encompasses a very large amount of information that we go over. One of the big things that we look at is leaky gut, that gut permeability where we're not able to absorb nutrients like we should. The microbiome, all those different bacteria, billions and billions of bacteria in our gut are crucial for proper immune function. We have to go through and correct that imbalance. The adrenal glands, every time the adrenals get revved up too high or too low, they're going to stimulate that same immune inflammatory cascade. Anemias. Anemia is one of those deal breakers, just like blood sugar. If we're not getting oxygen to our tissues, if we're not getting oxygen to the brain, we're not going to be able to heal and do what we need to do. So this is just a sample of all the different systems that we're going to get in depth into when we're able to evaluate these on a lot of different levels, from blood work to other functional diagnostic laboratory exams to symptoms to neurological testing. All types of different ways we're able to figure out which is our priority. Some person may have 4 that they need to go through, another person may have 5 totally different ones. Some people are going to cross over in the middle, but there is no autoimmune protocol. If somebody tells you that and looks you in the eye and says, we're going to treat you with our autoimmune protocol, run, because every body is unique. And we need to treat the body as that individual, not as a overall condition. So we're going to go through system by system by system to figure out which of these are out of balance, and we're going to correct those from a natural perspective, giving the body what it needs to regenerate, and we're going to be able to get that body to downregulate that immune inflammatory cascade and start getting your life back. Start to enjoy life. Stop the damage. We can do this together.